I'm Christina Chamberlain, and thank you very much for coming to our info session. Before we get started, I just wanted to let you know we are going to record the session. That way, if anybody's not able to make it, if you have any friends who weren't able to make it tonight, we can post it for them to see. Megan, could you hit mute because I don't see that since I'm on in the share screen. Are you able to hit record? Sorry, record. Got it. Okay, thank you. All right. So I am going to put, so that everybody knows, I'm going to put the lactation email in the chat here. And that way, if you have any questions, since there are a bunch of us, I'm not sure we're going to be able to get to everybody's questions tonight, but certainly put them in the chat and we'll get to as many as we can this evening. And then if we didn't get to your question, please go ahead and put it in, email it to us at the UCSD lactation@ucsd.edu email. All right, so my name is Christina Chamberlain. As I mentioned, I am the clinical director and lead faculty for the lactation program. And I'm going to go through just all of the different programs that we have for you. Oops, sorry. Maybe, Carol, can you be in charge of the waiting room and letting people in the waiting room? Will that be
Yes,
okay?
I have been doing that.
Oh, thank you. Thank you.
Sure.
And so also in tonight's meeting, we have Rose Divine Jakowitz, who is one of our instructors for the Lactation Education Counselor course and the Pathway 1 and Pathway 2 courses and the Lactation Education Refresher course. She does it all. We also have Megan Lee, who is the program manager for the Lactation Education Counselor course and the Lactation Education Refresher course. And we have Carol Landry, who is the program manager for the Pathway 1 and the Pathway 2 Lactation Consultant Education courses. So we're all here to answer your questions. All right, so let's get started. So our lactation program is through the UC San Diego Division of Extended Studies, and all of our programs offer relevant and evidence-based lactation education that's really pertinent for people who are already health professionals, as well as those who are just beginning their lactation journey. So we have a course pretty much for anybody who's looking just to expand their lactation knowledge. All of our courses are taught by master's prepared lactation consultants. Amongst us, we have clinical experience in a variety of settings such as the NICU, inpatient postpartum, outpatient clinics, whether that's through a hospital or a freestanding outpatient clinic, as well as private practice. So the first course that I'm going to talk about is our Lactation Education Counselor course. We call it the LEC course for short. This provides 45 hours of lactation-specific education over 1 quarter, which is about 11 weeks. The program is asynchronous in the sense that there is no live online classroom time. It's pre-recorded lectures that you watch on your own time. However, there are homework assignments that have specific due dates that you kind of turn in mostly on a weekly basis. So even though you can watch the recording sessions and you can do your readings on your own time, you do need to kind of stay on track with your assignments. This course really gives a great foundation for lactation knowledge for people who are interested in becoming lactation educators or counselors. And it does fulfill the academic and the counseling skills requirement for the Certified Lactation Counselor exam. So if that's something that you're interested in, this fulfills those 2 requirements. There are other requirements that are required for somebody who's interested in taking that exam that is beyond UCSD's offerings. We are not the ones who give that exam, so you'd have to look into that to see what their specific requirements are and how that pertains to your specific situation. But in terms of the academic and counseling skills requirements, this course does fulfill that. Some of the topics that we talk about in this course are how to achieve a good latch, how to recognize when a client and a baby need help with latching, supporting breastfeeding dyads in the immediate postpartum period, as well as for older babies. We talk about supporting preterm infants, common breastfeeding challenges, and how to problem solve, as well as how to conduct a lactation visit, a breastfeeding class, and support groups. So you get some experience with all of that within this class. The next class we offer, I want to talk about, is the Lactation Education Refresher Course, or the LER for short. And this is 20 hours of lactation education. This really is intended for people who are already working with breastfeeding dyads. They're either lactation counselors or they're already IBCLCs, and they're looking to get more continuing education. Whether it's, CERPs, this does provide CERPs, it does provide nursing credits as well. And this course really, the student is going to dive deeper into topics that aren't typically addressed in foundational lactation courses, just because of lack of time or lack of experience when you're in those foundational classes. So this goes through really interesting topics, I think, such as more looking at the science behind lactation, looking at some of the challenges to prenatal consultations and why those are important to provide in your practice, maternal nutrition support, as well as ethical issues. So if somebody was looking for eCERPs for IBCL, that's for IBCLCs, those are challenging to get, and this course provides some of those. And then we also talk about some ways to support pumping clients, because we're seeing more and more of that. So this is asynchronous online. So again, it's recorded lectures, but you do have specific due dates for homework assignments, and it's over a 5-week period. All right, the Pathway 1 Lactation Consultant Education Program is for those who are interested in becoming IBCLCs, and this provides 95 hours of lactation-specific education. And this is really geared towards health professionals who either already work with breastfeeding dyads, they have access to them in their job, or they've already arranged a way that they're going to work with breastfeeding or chest feeding dyads to complete their clinical hours. The UC San Diego Pathway 1 course only provides the didactic portion. So we will provide the 95 hours of didactic material, but we do not provide a way to complete the clinical hours. To be a Pathway 1 IBLC candidate, you would need to complete 1,000 clinical hours, and that's something that you would do on your own. Again, either through your job because you work already with breast or chest feeding dyads, or you've already arranged some kind of mentorship outside of our program to complete that. All of the topics that we discuss in the Pathway 1 course will follow the IBLC detailed outline. It's their blueprint for the exam, as well as LARC, which is our accreditation organization for the Pathway 2. We still use their clinical skills checklist when we created the curriculum for the Pathway 1 course. So just to make sure everybody's hearing it one more time, this program is just for didactic. There's no clinical component involved. Pathway 2, however, the Pathway 2 Lactation Consultant Education Program does provide the same 95 hours of lactation-specific didactic material in addition to 300 clinical hours. Pathway 2 is an accredited program. It's accredited through CAHEP and LARC, and basically that means they only accredit lactation programs that are housed within a university or college setting, and we meet their specific standards for our educational programming. So again, the topics that we discuss in this course follow the IBLC detailed outline, their blueprint for the exam, as well as the LARC clinical skills checklist. When interns, we call them interns because they are doing a clinical piece to their education within this program. Once they're in our program, we they work concurrently. They're completing their didactic at the same time that they're completing their clinical hours. So for in-person clinical hours, we will work with the intern to find a placement for them, whether that's in a hospital setting, a clinic setting, or sometimes with a private practice, IBCLC. But we will work to match them with a preceptor in their local area. Again, the didactic piece, these are all pre-recorded lectures. So in terms of when you complete the didactic, that part is asynchronous. The didactic does not require any live online class time, but you will have weekly assignments that you need to keep track of, those due dates. The clinical portion, it's done kind of, if you're in person, whenever you and the preceptor's schedule matches. We do ask that our interns be flexible because they need to match what the preceptor's schedule is. The preceptor is not going to change their schedule for the intern, so there needs to be some flexibility on that. And you can kind of work with your preceptor whenever the two of you schedule that, as long as your hours are completed by the end of the program. So you have the entire program to get all 300 hours done. Now, because of COVID and a lot of clinical sites were not allowing interns to complete their hours in person anymore because of COVID restrictions that kind of shut down that option, we created a simulation program that was approved, able to allow the use of technology for all of these Pathway 2 and Pathway 1 people to complete their clinical hours, knowing that in-person sites were not really open at this time. We just found out recently that IBLC has extended, so we can use that simulation program for another year. So we are able to provide that in addition to an in-person clinical setting. And the intern in the Pathway 2 program for fall, for this current cohort that we're about to start in September, those interns have the option of doing either all in person if we have a site placement for them, all simulation if for some reason they live in an area that doesn't have a lot of clinical sites. For example, people who live in rural areas might not have an IBCLC that can be their preceptor. So simulation certainly is a great option for them. Or we might have interns who choose to do a hybrid where they're doing some in-person and some simulation during the program to complete their hours. In the spring, we're going to have another Pathway 2 cohort start their program in the spring. And that particular cohort will only be 2 quarters. It will only be spring and summer. And the clinical placements will only be for simulation. So there won't be any in-person placements for that particular cohort. They will be completing their clinical hours 100% through our simulation program. So if that is something that you're kind of thinking ahead to, just know that in the spring, we are offering another Pathway 2 cohort where clinical hours will be 100% simulation, no clinical placements in person. So for the the Pathway 2, talking about clinical placement process, I guess I kind of went through this a little bit early. Again, really, regardless of how you're completing your hours, whether it's in person or with simulation, you just need to get all of them done, all 300 of them done by the end of the program. With a simulation course, that we are able to provide a 2-for-1 ratio in terms of hours. And what that means is the research really supports that. The way simulation is designed, where there's a pre-briefing and then the simulation of a clinical experience in addition to a debriefing afterwards, all of that really creates a much more robust and richer learning experience because you get really specific clinical information. It really provides a way to develop those clinical skills, clinical thinking skills, and you get all of your questions answered, which doesn't always happen in an in-person experience. So the research supports that 1 hour of simulation class is equivalent to 2 hours of in-person clinical time in terms of learning outcomes. So for that reason, if an intern is completing their hours through simulation, it's counted as double of what they would be doing in person. So if you complete 1 hour in a hospital working with an IBCLC, you've completed 1 hour of clinical time. If you complete 1 hour in our simulation program, you get credit for 2 hours. There is homework assignments that go along with the simulation, and that's part of that robust, deeper dive experience, which allows for that. So in some ways, it's less hours, and in some ways, it's a little bit more because of that. If somebody does have a clinical placement, the first step is once we have that clinical placement decided on, then the intern needs to work on onboarding process. All of our clinical sites require some form of onboarding, and each site kind of has their own way of doing it. But generally speaking, most of them have immunization requirements that every intern needs to have done. So we do encourage you to, if you know you're going to be a Pathway 2 intern, to think ahead, because sometimes this can be a longer process if you are kind of just starting your immunization, updating your records. So you're going to need a TB test, a quantiferin or T-spot blood test is preferred, but most places will also accept a 2-step PPD. Skin test, that's, you know, that's going to at least be 2 visits. So people need to think about that when they're getting all of their ducks in a row, so to speak. You'll have to have hepatitis B vaccine. If you haven't already had that, that's a 3-series shot over a 6-month period. Or you can show titers if you have had it in the past. MMR, Tdap, varicella immunizations also need to be up to date. And then most places are requiring a flu shot as well as the full series of COVID-19 vaccinations. Many states do have registries where you can obtain your immunization records through the registry if you don't already have that. For example, California's immunization record, there's the website right there. So for those of you who can look at your state's registry, that might make the process a little bit easier for you to gather that information. Other requirements are everybody needs to have basic life support, so CPR for healthcare professionals, background checks, and drug screening. All of these things are done after somebody has been accepted into the program and a placement has been set. We don't expect anybody to do this prior. Megan actually is the one who works with interns on their onboarding process, so she would work with the intern in getting all of this stuff completed. Some sites do have some learning modules, and that's really specific to each site. So sometimes you'll have some additional paperwork or prep work before you can actually start your internship that's site specific. And then we're also accredited. Our program, all of our courses are accredited through the ANCC, the American Nurses Credentialing Center. We have again, a really high standard for who is in our faculty and for the programs that we're developing. I should also say that for the simulation, if anybody is interested in that piece of it, I just want to go back. You see all of these lovely pictures of crocheted breast models and the like. So everybody who is in our Pathway 2 program gets what we call a simulation kit. And in that we include a breast model, a nipple shield, a tube and syringe, which can be used as a supplemental nursing system, so that you have some tools of the trade that you can use to actually learn some of those manual skills. You're creating more, it's just to create more lifelike scenarios when you're using those tools. So everybody would get that too. Again, so if you have any questions, either put them in the chat now. We should be able to answer some of them, but also I want to make sure everybody has the email that I sent out to the general UCSD lactation email. But here are individual emails, so please take note of those, and I'll leave this slide up for a little bit. But first I want to ask if Rose has anything she wants to add about the courses in general.
Let's see. Hi there. Hi, everybody. The one thing we do with the lactation counselor course and the refresher course, while it is all online, we do have 1 to 2, maybe 3 live Zoom meetings with all the students to answer any questions that they might have about any of the presentations or the homework. And the instructors are always available too, but we do have several get-togethers where we get to see you, kind of like this. I get to see you to answer any questions. And I will tell you, after 39 years of working in lactation, it's the best field, because you make such a difference in these new families' lives. In fact, I got a friend request from somebody that the name sounded familiar, and after saying yes, I got an email or a message from her saying Noah's 32 years old. So this was somebody I'd worked with 32 years ago. And so you will make a huge difference in their life. It's a very rewarding field.
That's awesome. Yes, and I also want to even though all of the classes, when I say the didactic is asynchronous, everybody is getting feedback, personalized feedback on your assignments from your instructor. So it's not like you're just out in cyberspace and you don't have any connection with the instructors. We all definitely give very individualized feedback on each of the homework assignments. Megan or Carol, do either of you want to say anything?
I think you did a good job covering things. Just working on answering questions in the chat.
Yeah, you did a great job, both of you. Thank you.
Sure. Yes. Should we look at the chat a little bit? I'm going to open up the chat over here. So I guess one question is the registration deadline. Carol, can you speak to that? The registration deadline for the spring pathway 2?
Well, we haven't actually opened up the spring application window yet. I would anticipate that it will be open maybe November to February. We're still working on pathway 2 for fall. So as soon as we have everyone for fall admitted, we will go ahead and post information about our spring 2023 cohort.
If somebody is interested in the pathway 2, there are some prerequisites for that. And one of them is the LEC course, the Lactation Education Counselor course, or an equivalent 45-hour course. So somebody said, does having a CLC already eliminate the need to attend the LEC? So if you're looking at that in terms of going towards the IBCLC or pathway 2 program, the fact that you are a CLC tells us that you've already done your 45-hour course, so you would just need to show proof of that, but that would eliminate, or that would fulfill that prerequisite.
Hi, can I ask a question?
Sure.
Yeah, so just so I'm clear, so you're saying that if like I were to take the Lactation Education Counselor course like for the fall, then I could possibly apply for pathway 2 for the spring?
Correct, yes. As long as it's completed before, and you would also, the other prerequisites are the 14 health sciences courses, and that's an IBLC requirement for their exam. So that's our prerequisite too, before you can be accepted into the pathway 2.
So I am a registered nurse, and so would that fulfill? Yeah, that fulfills those requirements.
Yeah.
Okay.
Yeah.
And then about how long is the pathway 2 program?
So the fall is 3 quarters or 9 months, and the spring cohort is 6 months, 2 quarters.
Okay. And so if you did do the spring, then you would only have the ability to do the simulation program. There wouldn't be any in-person mentorship.
Correct.
Okay.
Mm-hmm.
Okay. Would it be possible to, if I was hoping to do the fall, I guess that would be fall of 2023, then would it be possible to do any of the clinical hours with the preceptor before the program started, or no?
No, your clinical hours start once you're actually enrolled and the program starts. So, and part of that is once the program starts, so like say September for your fall cohort, you're covered under our UCSD's malpractice insurance policy.
Okay.
And so really that is very specific timing on when that policy is covering all of our interns. So if you wanted to do hours with your preceptor before, that would be for honestly, your personal enrichment, but you wouldn't be a UCSD student. You wouldn't be covered under our malpractice insurance, and therefore we couldn't count them towards your 300.
Okay. If you had done the LEC course, could you potentially work in some capacity, or even, for your own enrichment? Is that something that, I could teach a class at WIC or something like that? Is that?
That wouldn't count towards your pathway 2 hours. Okay. Yeah, your pathway 2 hours really only count when you're in the pathway 2 program.
Okay.
Yeah.
But I guess I'm just wondering if there's is there some type of employment or volunteer opportunities when you have completed that coursework, or not?
Yeah, I mean, sometimes, a lot of our students who have taken that course in the past, if they're wanting to move on to IBCLC, obviously that's one reason students are taking the LAC course. Sometimes their job requires a 45-hour course. They don't have to be an IBCLC. WIC oftentimes will ask for their employees to have some foundational knowledge, which is usually the 45-hour course. Okay. Some people are interested in becoming CLCs, but not necessarily IBCLCs. And if that's the case, then the 45-hour course would fulfill, moving on to be a CLC, okay, rather than going all the way to the IBCLC. So some people are interested in being lactation educators, where they're working for hospital settings and they're doing breastfeeding classes and things like that. So that might be all that they need in terms of lactation preparation. They don't necessarily need to be an IBCLC. So what I would say, part of that is kind of just what is your end goal in terms of what type of job you're looking for, and what's the best way to get there. Rose, do you want to say anything more about that? Do you have anything to add?
Yes, I do. As a lactation educator, you're more educated in the management of normal breastfeeding.
Okay.
You know a lot, like if somebody comes to you and says, I want to induce lactation, you know the basics, but it's the IBCLC that is going to go into the process of how to induce lactation. It's the IBCLC who's going to have the detailed hands-on experience in working with a premature baby, cracked nipples, mastitis, abscesses, things like that. So the lactation educator is more normal oriented, and you're really not designed to do a lot of hands-on unless it's obviously within your scope of your other job. If you're an RN, you work on postpartum, you work, labor and delivery, then yes, but whereas the IBCLC, that training gives you much more in-depth training on management when it goes beyond the normal, when it's outside of the normal range.
Okay.
And that's a good segue. Somebody had asked what's the difference in scope of practice between the CLC and the IBCLC. And really the scope of practice kind of is a result of the difference in training. So like what Rose is suggesting, the CLC is really educated and trained on normal. There is there's no hands-on clinical component to the educational requirements of a CLC, which is one reason why it's really management of normal, because there isn't that clinical experience for going beyond that. Whereas an IBCLC is really trained in the theoretical, the didactic, the hands-on, the clinical, and is geared to work in a variety of settings because of that clinical education. And so they are considered independent practitioners in the sense that they can have a private practice and be an independent provider, as well as being part of the healthcare team. Yeah, somebody has their hand up. Do you want to
Yes.
have a question?
Can you hear me? Yes. So I just have a quick question. So I am a NICU nurse currently, but at the moment I'm only working per diem. So would you recommend Pathway 2 just to fulfill the hours more quickly and become an IBCLC quicker?
Yeah, so IBLC does have a calculator. They call it the clinical calculator. It's an Excel spreadsheet basically that they've created. And honestly, if you Google IBLC clinical calculator, you'll find it. And they will help you, for those of you who are trying to get your hours through your job, they will help you determine how much of your job really can count. So for example, if you are a full-time NICU nurse, I think they will allow like 10% of your day to count towards breastfeeding. And if you're a postpartum, so if you're per diem, that'll be less, obviously.
Right.
So if that's the case, then Pathway 2 probably would be the faster way for you to get those hours. Mm-hmm.
Okay, great. Thank you.
Yeah. Sabiha, you have a question?
Yeah, hi. So I currently work at WIC, and so I'm able to provide breastfeeding support, and I also completed my CLE, and so I'm working towards becoming an IBCLC, and I've also completed the 14 courses. And so I guess my question is, it almost seems like I'm doing a combination of Pathway 1 and 2. So I'm kind of unclear on how I can get my hours. Like, would I be working Pathway 1 to do like my 1,000 hours, or would I have to still go through Pathway 2 and do like the 300 clinical hours?
Well, that really depends. Are you able to get your hours through your job?
Yes. Yeah.
So then you have to get all of your didactic and your clinical hours need to be completed within 5 hours of taking the IBLC exam. So in 5 hours, in 5 years. In 5 years, will you have 1,000 hours completed?
I believe so, because I've been working with WIC since 2018 and providing that breastfeeding support.
So my recommendation would be to look at that clinical calculator that IBLC has created to make sure that you are counting the hours that they will accept. And if you think you can get to 1,000, then you're Pathway 1.
Okay. And then does it need to be, because I work under like a registered dietitian who's also an IBCLC, so and those hours get signed off because we do like time studies, and so we have them already like set out that these are dedicated hours to breastfeeding support, and it's signed by and so is that something that I need to provide prior to sitting for the exam?
Yeah, even for Pathway 1, you don't necessarily have to have a supervisor, because the idea, like an IBCLC mentor, because the idea is that you're doing this on the job, but you have to have a way to validate those hours if you're audited. And IBLC does audit people. So for you, it sounds like that would be easy for you to validate those hours.
Yeah, exactly. And then in terms of like the 95 hours of education, since I completed a course that was only 40 hours to obtain my CLE, I would do the education course to
I'm sorry, you kind of went out. You already completed 45 hours, so you're asking, do you need to take a 95-hour course?
Or like another like course that's like 40 some hours to equal 95 hours.
Yeah, if you're going to do Pathway 1, you can complete those 95 hours however you complete them. So they don't necessarily stipulate where you get them. I do think it's easier and more cost effective if you do one class, but some people do piecemeal them together. For Pathway 2, it has to be through an accredited program.
I see. Okay. Okay. And then the lactation education course, the LEC, that's also like a 40 or 45 hour course?
45 hour. Mm-hmm.
45 hour. Oh, okay. So I could do that then probably.
Hey, okay, Christina.
Yep.
I have just a comment both from the Pathway 2 where the clinical is provided. A lot of, I think UCSD is one of the only programs that actually provides the clinical component, but I have seen lactation consultants that, and this is just from my experience as a lactation consultant, is if in your current job you don't have exposure to failure to thrive, preemies, the one thing, you know, that is so amazing about the clinical component is that is what you're going to be exposed to. If you've worked as a postpartum nurse for 40 years and in the last 5 years, you add up your clinical hours and you go, I've got enough hours, which you probably do, but there are definite benefits to doing that clinical component because you're going to be exposed to things that you don't see on postpartum. You don't go to pediatrics, you don't see the failure to thrive, you don't see the mastitises and things like that. So I guess this maybe is a little bit of plug for the pathway too, because you get that clinical, but because I do see a difference in those that don't take it, that, oh, I've been doing this for years, but they don't have the experience in the things that do come up. So I just have seen a difference. So just thought I would mention that. Thanks.
Yeah. I think it's also helpful if you know that in the pathway too, you have a preceptor, you have somebody who's mentoring you. And I would say in my experience, that's what I've seen in some of the pathway ones. If you don't have a supervisor or mentor who's taking kind of helping you with some guidance, then you might be missing what you're doing if you're doing it incorrectly or you know, not the most evidence-based way. So sometimes having that preceptor, that mentor, it makes a big difference. That's what I see. Heather, you have a question?
Yeah. Hi, thank you so much for doing this. So I'm working on my prereqs to do the pathway 2, and listening to you talk about the simulation of the clinical hours that sounds amazing. But my question about that is, if we go that route and we do simulation, like if I think I'll be ready for the spring cohort, does that put us at a disadvantage when we're trying to find a job after, because we don't have that like connection with an actual hospital or organization?
Yeah, I think that's a really good question. What I can tell you, so we've been running the simulation piece for the simulation course for 2 years now. We've definitely had people who've gotten hired, not necessarily from a preceptor. We've had who have done 100% simulation, so they didn't have a preceptor during the program. Some of those people are nurses, some of those people are not nurses, and they've gotten hired. Some of them got hired even before they took their IBCLC exam. They you know, were hired exam pending. And so I think it really runs the gamut. And in my experience, and then I know some people who feel like they really need to have more hands-on experience. They don't come from healthcare backgrounds, so they feel like they really want to have hands-on experience. And so those people, what I have seen is they have done more networking in their community. I mean, even if you have a preceptorship, an internship with a preceptor at one hospital, it doesn't necessarily mean you're guaranteed to get hired at that one hospital. So I'd still encourage you to network with your community of LCs. So some of these interns have done that, and they have met private practice interns who have them shadow for a while and work with them, so they get some experience and some more hands-on under their belts. They've attended, I've seen some who have attended support groups and then become co-leaders of those support groups to help them get some more experience. Those are often the people who come with no healthcare background. So that's a lot of it, is to help their own confidence. So, you know, I would say look into your area and kind of look at what I would start doing job postings, like read job postings in your area and see what are they looking for, how much experience are they requiring, are they willing to hire people with no experience, that sort of thing, and kind of train on the job, because I just have seen it kind of run the gamut. But I definitely have seen people who've done 100% simulation with no healthcare background get hired for things.
Okay, great. Thank you.
Yeah, Michaela?
Hi, I had a question about the Pathway 2 program. So for the Pathway 1, you have to have 1,000 hours, but Pathway 2, is it only 300 or do you have to get an additional 700?
Nope, it's only 300.
It's only 300.
And the
Okay,
idea for that is because you are working directly with an IBCLC mentor preceptor.
okay, great. So my background is I'm a nurse, but not postpartum, not NICU. We do mostly like cardiac infants.
Mhm.
So we're a step down to the CTICU. I completed the comprehensive program through Northridge, but I believe now they require an extra 5 hours of a communication class, but
Mhm.
I've also not had any like clinical experience. So I'm still trying to figure out what's best, if I just retake a program altogether, or do I try to reach out to a preceptor and finish it on my own?
If you were going to reach out to a preceptor and finish it on your own, you would probably be a pathway 3.
Oh,
So
there's another
just to
pathway.
confuse everybody even more, there's a third pathway.
Oh my goodness.
So the pathway 3 is really where you have identified your own mentor, and you two together have come up with your mentorship, your like curriculum, your syllabi, whatever you want to call it. And that is 500 hours.
Okay.
And that you have to create kind of a proposal to your mentorship, and you send that to IBLC before you start. They approve it, and then you can start. So that's really geared towards somebody who has identified who their specific mentors are going to be. You would still need the same 95 hours didactic.
Okay, so I just need a 5-hour like communication course from anywhere?
Yeah.
Okay.
You would find something that's like a SERP that would give 5 hours of.
Oh, okay.
Yeah.
And then if I don't know any IBCLCs, do you have anybody that you like a network or any place that you can reach out to? That's like my biggest
Honestly, I would
problem.
Google. Even when I'm looking for sites in Texas, I Google to start my search for a preceptor. If there's a breastfeeding coalition in your area, I would recommend that you get involved with the breastfeeding coalition and start networking. If you work in a hospital that has IBCLCs, I would reach out to them first, because that's probably your easiest way. But I would look at the IBLC website, and they'll have the 3 different pathways listed there, and that'll give you kind of more information to see which is the best for you.
And to complete those 500 hours, does it have to be with just one preceptor the whole time, or can you have multiple mentors that complete those hours?
You create your proposal, and as long as IBLC approves it, then that's what you do.
Oh,
But
okay.
you can't do anything unless IBLC's already approved it.
Okay, great. Thank you so much.
Mm-hmm. Sure.
Christina, would you mind, there was a good question about the 150 hours in simulation versus 300 clinical hours. Do you mind speaking to that a little bit?
Sure. Yeah. So that speaks to the idea that simulation is kind of worth double the time. And that is because the way simulation is designed, anytime we have a clinical scenario that we go through, we start off first with a pre-briefing where we go through the objectives of that scenario. What are we thinking before before we walk into the room, what are we thinking with this client? What questions do we want to ask them? What assessments do we want to do, and what are we looking for, so that we're preparing before we actually meet our client? Then we go through the simulation, which for our program is either as a role play simulation where one person is the lactation consultant and another is the client, or we have telehealth type visits where we do case studies through telehealth visits. And then after the role play, then we go through a debriefing, and the debriefing really breaks down, how did you feel in that scenario? What worked? What didn't work? What questions did you have? What challenges did you have? And that's really where the bulk of the learning happens, in that debriefing. And so research has shown that when simulation is designed this way, very specifically, when simulation is designed this way, it creates a much richer learning opportunity which leads to equal to or better learning outcomes than if people are doing in-person clinical settings. In-person does not guarantee that you're going to have this pre-brief and debrief situation, because if you're in a really busy setting, your preceptor may or may not have time for that, to be honest, or you're kind of just getting whatever client walks through the door. Whereas in our simulation program, we've created specific scenarios so that you meet the client we want you to meet to go through those types of situations. And so research supports that we can count 1 hour of simulation class as 2 hours towards the clinical requirement. So that's why you are going to be in class like bottom in the seat for 150 hours, but you'll get credit for 300 if you're doing simulation. CLS, is that certified lactation specialist? That's a certification, I believe, Rose, you might be able to answer this better than me, but the CLS, that's a very specific curriculum and exam, I believe, right? Isn't that through Kappa? No.
It could be, but it's also extremely similar. It's like the lactation educator course, depending on where you get your training. You could be a counselor, you could be an educator, you could be a specialist. It's almost basically the same as an educator, but it does depend on where you get your training as to what your title is when you're done.
We're getting to answering most of the questions.
I do know that I think it's the IBCLE website, maybe ILCA, I'm not sure, that does have a list of lactation consultants all across the country that some have said they'd be willing to be mentors. And I will tell you, if you're not enrolled in a program like UCSD, it's extremely difficult to get into hospitals just because of, one, COVID has made it really hard. But even before COVID, from a liability standpoint, it's really hard to just go and knock on their door and say, hey, I want experience as a lactation consultant. Having a program behind you makes it so much easier.
A lot of that is liability, because these hospitals, there's a very specific contract that we have to enter into with them. There's the malpractice insurance piece. So in my experience, most people who have been successful with a Pathway 3 type of program have created that either with a private practice lactation consultant or a freestanding private practice outpatient clinic. But Rose is right, it's harder when it's a hospital type of facility. Yeah, Claudette?
Yes, I have an MPH. I need the clinical hours.
You have an MPH?
Or the health classes that I need. I have an MPH. I have a master's in public health.
I'm going to let Carol speak to that. I think you would have to send your transcript for Carol to look at.
Okay.
I'm sorry, I was responding to another message, Christina. You have an MPH?
Yes.
Yeah, she's asking if she needs to take the health sciences or if that would cover it.
We could look at your transcripts. If you've taken those courses and earned a passing grade, we can certainly accept those courses. But if you haven't taken the 14 classes, then you would need to take those.
And those 14 classes, that's an IBLC requirement, not necessarily UCSD. I mean, IBLC is the one who says you have to have these 14 classes. So you could go on on their website, they list out what those classes are, and you could say like, oh, I've definitely done this, or oh, you might know if you've done them or not. So I'm not sure, Sibi, if this is answering, is it possible to only complete the 300 clinical? The 3 pathways all have the same 95-hour didactic requirement. What makes them different is the number of clinical hours and how you complete those clinical hours. So pathway 2 is the only pathway that has a 300 clinical hour requirement. I think that's the question you're asking. If you're pathway 1, you have to complete 1,000 hours. If you're pathway 2, you complete 300 hours. If you're pathway 3, you complete 500 hours. And again, the ILC website has the different pathways more explicitly spelled out, so you can see what works best for your specific situation.
Okay, got it. Thank you.
Mm-hmm.
I have a question.
Sure.
So my situation is, I would like to be an IBCLC. I've been working for the 14 requirements. I have still, I'm taking ethics class right now, but I have 2 more online through UC San Diego to take. I'm going to be beginning Adventist Health COPE Health Scholar Program here in the Central Valley of California, and working in hospitals. So I have to do clinical hours already. And after I do so many clinical hours, like at a specific hospital, I can actually transfer to a specialty unit, like they have a maternity ward, I guess. They have a birthing center. There we go. Where I can, they do have an IBCLC that I can work with and whatnot. Do I need to be enrolled first in order for those hours to count? I'm supposed to be starting pretty soon here.
Are you planning on pathway 2?
I was thinking it was pathway 1 is what originally I thought I was going to be doing, but now I'm kind of confused. I have found 2 different places here in the Central Valley that I can do my hours at. They're willing to.
Are you doing them as a
me,
student or as an employee?
Student.
Oh.
Or, well, an intern.
Okay. And so do they think that you're a UCSD student doing them through UCSD?
Eventually, yeah. I mean, the COPE Health Scholar, COPE Health Scholar is geared towards like usually RNs or anything that's in the healthcare setting. And so for that, I'm to do the program, I'm supposed to do 280, but my program manager said I could stick with the program. I could be continuously in the program to do my 1,000 hours if I wanted.
So if you're pathway 2 and you're complete, your goal is to, if you've been, you applied and you've been accepted into the pathway 2 program, you only have to complete 300 clinical hours. However, none of those clinical hours can be done until the program, the pathway 2 program has started. If you think you're pathway 2, that's how that works. If you are pathway 1, then you're just, I'm guessing, doing the didactic through UCSD, and we have nothing to do with your clinical hours. That's something that you do all on your own.
Okay, yeah, that's pretty much what I was planning on doing is in spring, just doing the didactic part and, you know, starting my clinical hours. And I have 2 different places that are willing. So well,
I will say if you're doing pathway 1, though, you're not a UCSD intern and you can't necessarily represent yourself as such because we don't have anything to do with your clinical hours and you're not covered under the UCSD malpractice insurance. So even though you're pathway 1, you're taking the pathway 1 didactic, you're not a UCSD intern when you're doing your clinical hours as a pathway 1 student.
Okay. So I could do it possibly through like my COPE Health Scholar program that is already, because I'm already having to do like the Hep B titer and all that stuff to get into the hospital. I'm already having to go through all that. So felt like I could probably just do it through the Health Scholar program then and do the 1,000 hours.
Sure, it sounds like that's kind of what you're.
Is that okay? Like I could be doing that?
Sure, yeah, because again, we have nothing to do with your 1,000-hour clinical time. So if they're willing to, if they're willing to keep you as I mean, 1,000 hours is a long time. So as long as they're willing to keep you as a student for that length of time, then sure.
Okay. All right. Thank you.
Sure. So let me read them. So for are you talking about this, Randy, you're asking about the 2023 simulation schedule for spring, right? So if you're on spring, I can tell you usually our classes are either they're all Pacific time. And then if you don't live in the Pacific time zone, you adjust to be there during this Pacific time. But our classes, we usually have one class that is during the daytime hours and then another class that is split among 2 evening hours. We have interns who are, in class until 10:30 at night because they're on the East Coast. Right now, we have a couple of international students who are doing simulation, and I don't even know what time they're up, but they're, everybody kind of adjusts their life to make it work. But that's usually what it is. It's one daytime class or a nighttime class that's divided among 2 different nights in a week. The simulation class for the spring, where it's all hours are going to be done through simulation only. The class itself is about 7 hours a week. And so if you're in the daytime class, then you're doing a 7-hour Zoom. It sounds worse than it is. It's not that bad. But it's a 7-hour Zoom, or you're doing like 2 different evenings. So like 3.5 hours, 2 nights a week. Yeah, so again, I think we covered most of the questions, but if you have any questions after this evening, feel free to email either us individually. If you have questions about classes, you can email me at klchamberlain@ucsd.edu. If you have questions specifically about Pathway 1 or 2, it would be better to email Carol Landry. If you have questions about lactation education course or a lactation education refresher course, an application, then it would be better for you to email Megan Lee. And if you have questions about those from just a content perspective, those questions would go to Rose. And then if you have just general questions and you don't remember who you're supposed to email, then just email the general lactation email and we'll get back to you. So I really appreciate everybody, all of your questions, being thoughtful. Thank you for your time, and definitely thank you, like Rose said, for looking into being a lactation, whether it's a counselor or a consultant, because we need more. Families need that support. So thank you very much for wanting to be there for them.